Joining us now is Senior Medical Director of Blue Cross and Blue Shield of Alabama, Dr. Schmidt. Dr. Schmidt, thank you for speaking with us.
Thanks so much for having me.
Let's talk about this new Blue Cross Blue Shield Health of America report on maternal health that was recently released. I know there were some alarming points that have come out of it as it relates to women's health. What concerns have you had over the past several months with COVID-19 and women's health?
Yeah, absolutely. COVID's affected all of us in so many different ways. It's affected where and how we work. It's affecting how we're doing this interview, right? I'm at home in my kitchen and you're alone in the studio, and how our children are educated. And it certainly is affecting how we access healthcare. And one thing about pregnancy is this isn't an elective procedure that can maybe be postponed or put off. It's critical that women be able to keep all of their prenatal visits as scheduled. So knowing that, and then also knowing that the CDC just last week added women who are pregnant to their list of people who might be at higher risk for serious outcomes of COVID if they do catch the coronavirus is really concerning. So we want to do all we can at Blue Cross to make sure that we expand access as widely as possible for our members who are pregnant.
Right. Now, the report showed 1 in 4 women surveyed have skipped prenatal care appointments since the start of the pandemic. What kind of problems can that lead to down the road for these women?
Yeah, absolutely. Keeping prenatal visits following your provider's recommendations are really the best way to help ensure a healthy pregnancy. This lets you catch any problems early, say high blood pressure. You might be having symptoms like headaches or leg swelling. Your provider can assess that early before it causes any long-term harm to moms or babies. And it also really allows women to express their concerns, ask any questions, make sure that the baby's developing, progressing in the way that he or she should.
Okay, now what should these women do if they are pregnant and worried about going to their healthcare providers?
That's a great question. You should always reach out to your provider first if you have any questions or concerns. Ask what precautions they're taking, and also ask if telehealth is an option for you. We kind of mentioned telehealth a little bit earlier, and when we expanded our access to our members in Blue Cross Blue Shield of Alabama, we included not just primary care and behavioral health, but all of our specialties, and OB was one of those specialties. And since we've expanded that in mid-March, we've seen over 5,000 members take advantage of telehealth just for OB. So we know it's been helpful. We know it's been popular both for patients and for providers. So we just encourage you, if you have any concerns, problems getting to your appointment, worries about coronavirus, reach out and see if telehealth might be an option for some of your prenatal visits.
Okay, great information there. Now, the report also suggests many women are experiencing things like postpartum depression. Speak on that. What are some of the factors during pregnancy and even after?
Absolutely. That's one of the concerning factors that came out in this Health of America report. We saw nationwide there's been a 30% increase in women diagnosed with postpartum depression just since 2014. We know that women who come into pregnancy with any underlying behavioral health conditions, so say depression or anxiety or substance use disorder, they're more likely to develop postpartum depression. But we also know that 1/3 of women don't have any underlying behavioral health conditions going into pregnancy and still can develop this. So just really want to encourage everybody, if you're having symptoms, if you're feeling anxious or sad, if it's affecting how you're able to cope or function, to just please reach out. Your obstetrician can make a referral for you, your primary care doctor. And Blue Cross members can also go to alabamablue.com and use our provider finder and find an in-network behavioral health provider near you. And remember that our telehealth expansion included behavioral health also. So there are options available. If you need help, we just encourage everyone, please reach out.
And I feel like you did just touch on this, but specifically, how can these women reduce their stress levels and anxiety?
Yeah, absolutely. We kind of talked a little about this report about, pregnant women specifically with COVID. You're under the stress of pregnancy, the extra anxiety. And one thing we found is over half of these women were not able to have a loved one in the delivery room with them. And so you just think of the added stress that that can cause, the changes in their delivery plans. 28% had to change hospitals and 15% had to change providers. And that's for safety's sake. It's for, prevention of spread of disease. We definitely support that. We just encourage everybody, again, always reach out to your provider. Also think about decisions that you make about food, about activity, and about sleep. It really can help impact resiliency and just really kind of reduce some of that stress.
Okay, great advice. And finally, what are some of the ways Blue Cross Blue Shield of Alabama is working with these patients?
Yeah, so one of the things, if you go to alabamablue.com, you will see a COVID-19 link or banner at the very top of our page. We have resources there, links to CDC, to the Alabama Department of Public Health. We also link to a website with New Directions Behavioral Health, who's our behavioral health partner. They have a phone number there with 24-hour access to a licensed counselor. So anyone who's having concerns, issues, anxiety can call that number, and we can speak to you then through a licensed counselor, or they can connect you with other resources. For pregnant women specifically, we have Baby Yourself, which is a prenatal program that will connect you with one of our nurses who'll walk with you through your pregnancy and answer any questions that you might have. And help keep you compliant with your appointments also. And again, we just encourage everybody, remember, telehealth might be an option. Always reach out to your provider and do all you can to please keep all those appointments.
Wonderful. Seems like there are very many options for people who are in need of your services. So Senior Medical Director of Blue Cross and Blue Shield of Alabama, Dr. Ann Schmidt, thank you for speaking with us and giving us this information.
Thanks so much.